When children need orthodontic work, there seems to be a couple of options. Braces, which are staying in there, they're like literally cemented in, or anyway, they're like unremovable. And then these days we have removable braces. Can you shed some light on the difference of it?
Well, traditionally in America, helmet braces have been the only way to go. And braces, the fixed appliances, as we call them in dentistry, they work very well as far as straightening the teeth. Obviously, they're going to make a very cosmetic look. But sometimes in children that are like 8, 10 years of age, sometimes even younger, but 8 to 10 years of age, they can have removable appliances. There are different ones made by the name of Crozat or Jackson's. There's a lot of different types of appliances out there. But removable appliances are functional appliances like they use in Europe. You might be, you may know about that from Austria, since you're from Austria. In Europe, the functional appliances are done, or a removable appliance, because it actually moves the bone. And in moving the bone, hence, you make more room for the teeth. And so over a period of time, especially as a child is developing 8 to 12 years of age, they can have the bone move at a much easier rate than when a child traditionally goes to the dentist for braces in America, which is usually 10, 12, 14 years of age. And when it gets to that point, then the removable appliances don't work as well, and you have to go to fixed appliances. That'd be the braces. Okay, so it's two different ways of looking at doing dentistry: braces, moving teeth, straight teeth, versus functional, the removable appliances. Once again, as I've said before, it isn't either or, but a combination of both that is needed. So a parent comes in and says, I want braces, or I want this or that. The dentist usually is wise to look at different options that can be done for that child.
Okay. And then depends on the situation of the teeth, you kind of, the dentist will recommend what he thinks is the best option to go.
Yes. And the youngest child to be treated orthodontically, in my opinion, are what we call in dentistry Class 3 patients. A Class 3 patient with a lower jaw is further forward than the upper jaw. 95% of the time, that's only 5% of the population element. So a very small amount of population, but for those, it's devastating if it's not treated young. Because if you figure you get a young girl and she has that lower jaw, protruding further than the upper jaw, it gives them more of an aggressive look, an assertive look, and obviously, unless you want to be a lady wrestler when you get older, you don't want that look. And so the situation is, I like to get children into the orthodontist around 8 years of age, 8, 9 years of age, maybe sometimes even 7 when they have a lower jaw forward. It is not a lower jaw problem so much, most of the time, 95% of the time, as it is an upper jaw problem. It's the upper jaw, the maxilla, is not growing fast enough, not the mandible growing too fast, the lower jaw. And so, hence, they can get in the orthodontist, and the orthodontist can help that situation with a removable appliance, usually, sometimes a fixed appliance, at even 8 years of age.
I see. So, basically, the same principle applies, only because we have email and can communicate with email, and we can communicate with, let's say the way we communicate here now, where, instant video, and it's all wonderful, but that doesn't mean a good old-fashioned love letter it should never be written anymore, right?
Right. Thank you notes are nice.
Yeah. Okay. So same there. So let's not, because of a new thing coming up, totally eliminate the other one and have to make the choice of one or the other. It's kind of like, okay, how can we pair them up? Like with, I don't think you do many dentures with children, but, I know that dentists, people come in with dentures and they don't fit anymore and they're kind of wiggle-woggly, because it's not that the denture was bad, the denture stood the same, it's the bone shrunk, so the denture don't fit anymore. And now you have this new thing, I call it simply a hybrid, where you put implants, couple 2, 3, or 4 implants with the denture, so you don't have the huge outlay for lots of implants, and yet you drastically increase the fitting and the comfort of a denture and the longevity of a denture. So basically mixing 2 things up. Yeah, I mean, hey, fusion cuisine, you know, I mean, Chinese and American and Italian and whatever. I mean, it's always good, right?
That's right.
Okay.
Usually.
All right. Right?
I said usually, yeah.
Yeah, usually. Well, all right. So basically, you know, let it up to the dentist to kind of give you the 1 or 2 better options, and then some of them have to do with a decision of money, of time, of, you know, you give a little for this and you give a little for that, but the dentist will keep you in the dream of this is an acceptable area. You know, you don't want to go out of that area, but in this area you can make the 1 or 2 decisions you want to make. I love it.
That's right. Alternatives.
Thank you very much, Dr. Leisle.